Beyond Baby Blues, Addressing Postpartum Stress and Mental Health and Black Women. Okay. So, this conversation, I know I usually talk about Black women in toxic jobs, but many of us are mothers too. So, thought it would be important to have this conversation as well. If you don't know me already, I'm Dr. Kamani. I'm a licensed clinical psychologist, a toxic job survivor. More importantly, I'm a toxic job liberator for Black women. My channel talks about ways to support Black women leaving and healing from toxic jobs. If you haven't already, gotten your ticket for the Job Liberation Virtual Summit for Black Women, May 18th and 19th, please get your ticket. And you can also sponsor a Black woman to attend by emailing me, and my email information will be in the description section of the YouTube channel. So I'm excited to have Dr. Luces-Sampson with us again today. So if you could introduce yourself and we'll get right into the conversation.
Yes, thank you so much for having me. I am glad to be back. I am LaToya Luces-Sampson. I am an OBGYN and coach for physician moms who are in the early years of motherhood. And I'm also a Trinidadian. I'm also a mother of two and a wife and all of the ands, and other things.
Yes, yes, yes. Well, thank you so much for being here today. So, I think many of us, unfortunately, have heard about for Black women how we have
Mhm,
disproportionate rates of mortality during childbirth and
mhm.
infant mortality. I think a lot of us are aware of that. But the conversations about baby blues and
Mhm.
postpartum depression, we don't really talk that much about that in relation to Black women. So that's why I'm
Yeah.
so happy we're having this conversation today. Can you talk a little bit about what does this look like with the patients that you have, Black women patients you have?
Yeah, so this is a very, very important topic for me. So I'm also glad we're having this conversation, especially because we are now in the middle of World, Maternal Mental Health Month. The month of May is now that we're focusing on this very important issue that, like you
Mhm,
said, is really not talked about a lot, and
mhm,
especially in Black women where we are underdiagnosed, we are
mhm,
overrepresented in the amount of actual experiences, even though it's underdiagnosed,
mhm.
undertreated, and may go unrecognized because it may look different in Black women.
Mhm,
So there's so many different layers to why this is so important in our community. So,
mhm.
it's really important for us to start talking about it so we can
Yeah.
recognize these signs in our patients, our family members, ourselves, right? And that we can get help, because that is the goal of all of this, is so that people don't suffer in silence and
Mhm,
that they know they are not alone, and with
mhm.
help they will be well, right?
Yeah.
So the reason that, well, one of the many reasons that we see these disparities, besides the obvious reasons, racism, right?
Mhm,
Besides that one, is
mhm,
that it, some of these symptoms may look different in Black women, right? So when you
mhm,
think about postpartum depression, the image you have in your head is usually somebody in bed for days
mhm,
on end, crying, they don't want to do anything, and, it may look like that, but it
mhm.
also may look like blunting, right? Just having a flat affect. You talk about things that are traumatic with a very monotone. It may seem like you don't care,
Mm.
but maybe
You
that's
kinda
how
check
you are
out.
processing, right?
Mhm,
Like that may be how you're processing your trauma. That may be your defense mechanism. You may
mhm,
be more irritable. You may
mhm.
be angry. And, with all these stereotypes that come with that, with Black women, it's easy to
Yeah.
miss it, especially if you're
Mhm.
you're not checking for it, you're not checking for us, and
Right.
you don't even have this in your mind, right? So it can look differently sometimes. So
Mm.
it takes a discerning eye. It takes all of us who care for women who are in this stage to be
Mhm,
really looking out for it and being vigilant so that
mhm.
we don't miss this and people don't go undiagnosed and continue to suffer.
Oh, wow. So you said it takes a discerning eye, right? So
Mhm.
is your perception that many in the medical field have this discerning eye, or what do you notice for the experience of Black women as they go into medical doctors? What do you notice? Do you feel like it's missed, or what do you feel
Mhm.
happens?
Well, it's not a feeling, unfortunately. There's data to prove that it is missed. And
Mm,
not just for Black women, it's one of those things where it's missed for a lot of people.
mm,
And it's like with most disparities, we get the
mhm.
worst end of it because we also
True.
have that added layer of racism, right? That intersectionality gets us every time.
Mhm,
So it's one where we as a field, as OBGYNs, are lacking. And
mhm,
thankfully, there has been more attention being brought to this area. So
mhm.
awareness is increasing and things like that. So we're on the right track, but we're not there yet. Right.
Got it.
So that's why, I can't change the medical system, but I can educate people. I can use my
Yeah.
platform to get the message out so that
Mhm,
you are armed with the information so that you can
mhm,
advocate for yourself. And really, when we talk about advocating for oneself, it is a
mhm,
really huge charge to
mhm.
put on
I was gonna
somebody who is
ask you, that's my
suffering,
next question. Yeah, 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 yeah.
right? So
Uh-huh.
I am passionate about everybody else getting this information as well and taking
Mm,
care of our moms, right?
yeah,
Because they need us. We need you,
yeah,
right?
yeah.
We need everybody to be aware so that the additional burden is not on us to
Mm,
fight through this and advocate for ourselves and do all the things while we're
mhm.
trying to get well.
Yeah, yeah. So later I'm gonna talk to you a little bit more about those who are around the
Mhm.
mom, right? The mom who just gave birth. But what if a Black woman doesn't really have a supportive network around
Mhm.
her? What are some ways that she can advocate for herself if she's experiencing like the baby blues or postpartum
Yeah.
depression?
So let's talk about the difference between those two, because
Okay.
that is, the most important part of advocacy is having the knowledge to know even what to advocate for,
True,
right?
true.
And the difference in that I think is very important because for most people who have babies, there's a
Mhm,
misconception that depression, postpartum depression, is a severe form of the baby blues, and that's actually not true. They are
mhm,
two completely separate things, right? So the baby blues is actually not even a disorder. It's not a diagnosis. It's just
mhm,
a normal thing that happens when you have the baby. So it's
mhm,
due to all of those hormones coming down, right? The placenta comes out, your
mhm,
hormones drop, and such
mhm,
a huge shift in hormones in a very short space of time
mhm,
causes all of those wave of emotions. You
mhm,
feel weepy, sad,
mhm,
just overly sensitive, you may
mhm,
say. And then also you add in the exhaustion, just the
mhm.
overwhelm, all of those things, right?
Yeah.
So that is expected and normal. And usually the thing that distinguishes it from depression would
Mhm,
be the length of time. So
mm,
the baby blues are going to show up within the first couple days after birth, and
mhm,
they will end by 2 weeks. So if you hear somebody saying, I had the blues for like 6 months postpartum, or they're currently postpartum and it's been months and months, and they're like, oh,
mm,
well, I have baby blues,
mhm,
it's not the baby blues, right?
mm,
And the reason that is important is because all of that time that you think that it's just blues, and we
mhm,
know that blues goes away, right? We know
mm,
that it's going to get better eventually. You're going to
mhm,
continue waiting and waiting and waiting for this
mm,
thing to go away when you really have untreated depression or you really have untreated anxiety, right?
mm,
So it is the most simple thing but I harp on it so much because it is so important.
mhm,
It's just a simple thing to know, but it can make a huge, huge difference in
mhm,
your recovery postpartum so that you know that if it's lasting longer, it may not be necessarily that you have a diagnosis, but you
mhm,
do need to say, okay, I need help. I need to get evaluated and I don't feel well. Let me go
mhm,
get checked out. And
mm,
when you are postpartum, your doctor usually gives you a depression screening.
mhm,
When
mhm,
you fill it out honestly and make
mhm,
sure that they read it, make sure that
mm,
they actually address it because
mm,
it's something that they are supposed to review with you before you leave,
mhm,
so it's not just it happens often, right? You fill it out and then they never mention it again. It may be
wow,
that they read it and it was
Mhm.
fine, so they didn't do anything, but it may be that they did not read it, right?
Wow. So
Or
one way
they y
is to make sure that they looked at it, they scored
Yes,
it, they're following up with you about it if more support is
correct,
needed. Okay.
correct.
Mhm.
Yeah, and I feel like that is probably the most important thing because
Mhm.
we can't really do anything without that screening unless
Right.
you're a psychiatrist, right? Because you usually will be seeing your birth provider, so your OBGYN, your midwife, or even your PCP,
Mhm.
and that is a really essential tool, and it's actually a
Mhm.
free tool that is online. I
Mhm.
have a list of postpartum mental health resources on my website, and that's like the last one on there. The one that I use in my old practice is called a PHQ-9. There are
Mhm.
lots of them out there that we use officially as OBGYNs, and it's
Mhm.
not for self diagnosis. It is just so that you can get a visual representation by these numbers to say, okay, I need somebody else to look at this. I may need
Mhm.
help, right?
Yeah.
So you have access to these things and
Mhm.
knowing, okay, they're supposed to score it, they're supposed to discuss it. And,
Mhm.
if it's being ignored, the numbers, the scale is everything is online. So
Wow.
it's easy to have the information and know if, your numbers are appropriately being addressed and
Mhm.
just to even start a conversation about it.
Yeah. So I'm going to put that information description section, everybody, so we'll be able to access that. So is there any data that talks about the rates of baby blues? I know it's not a diagnosis, but the rates
Mhm.
of that and postpartum depression for Black women as opposed to other groups? Like, do we have higher
Mhm.
rates? And what
Yes.
are some of
Yeah.
the issues that might contribute to the higher rates as well?
Yeah. So there's data, and the reason I smirk is because, well, there's data that says we get the worst end of everything, and
Absolutely.
it's like if I don't smirk, I'll cry. It's just like, well, yes, of course we have the worst outcomes, the highest rates, higher than any other group, um,
Mhm.
and we know the reason, right? It's
Mhm.
not race, it's racism.
Yes.
So yeah,
Glad you said
it's
that.
yeah.
It's not race, it's
Um,
racism. Yeah.
yeah, so there's nothing wrong with you. There's nothing inherently wrong with you, Black woman, to make you more depressed. It is the system that we live in. It is the constant assault on our beings as Black women and as
Mhm.
a people. So don't be disheartened by this information.
Mhm.
Just know it's not you. It's them.
Yeah. Yeah. And the importance of advocacy, right? So knowing
Yeah.
that there are screeners available, knowing that you can
Mhm.
advocate to your doctor about certain things. But I'm wondering too, when you said this, because you said the depression might look like irritability. And
Mhm.
so for us as Black women, we know about the stereotype about the angry Black woman. So
Mhm.
if a Black mother goes into the doctor and she, is irritable, the doctor
Yeah.
might kind of write her off as, oh, she's just difficult or whatever. So that's why
Yeah.
it's important that people around her also know that that could be a symptom, and maybe that person who's with her or a family member can advocate for her as well,
Yeah,
right?
and they
Yeah.
they would know the change, right? So if this is a new thing, which it may not
Mhm.
be, but if this is a
Mhm.
new change due to the fact that she is postpartum, the
Mhm.
family member or friend or whoever can say,
Mhm.
this is not normal, this is not her,
Right.
right?
Right.
Because she may not see it, she may not be able
Mhm.
to articulate those words, but
Mhm.
the people around us, if you have that support, can say,
Mhm.
this is not right.
Yeah, yeah. So can we just go just a little deeper about racism, right? And the impact it might
Mhm.
have on a Black mother. So when we think
Mhm.
about like the additional stress that she might experience, let's say if she has a job, right? And what she
Mhm.
experiences in the workplace, or let's say access to certain resources that might impact her stress level as well. So there's a number of things because of racism that might put her in situations that might add to her stress level in addition
Mhm.
to the stress of having a child. So
Right.
all these issues might contribute to what's happening. Okay. Got it. Got it. Okay.
Yeah.
So we're going to transition just a little bit and just ask you, in terms of your own
Mhm.
experiences postpartum, if you're able to share that. And you know what I really appreciate about this too
Mhm.
is to be able to have a Black woman medical doctor to talk about it, not only from clients, what she's experienced, but also what you've experienced yourself. I
Yeah.
just find that so helpful. I share things openly on my channel. So I appreciate that you are willing to share about your own experiences as well.
Of course. And it's all a matter of talking about it and
Hmm.
getting the word out. So again, people know you're not alone. Like
Yes.
everybody from every stage, every walk of life goes through these things and experiences these things.
Hmm.
So when we know about these stories, we can find ourselves, we can have a little bit of solace that, oh, okay, nothing's wrong with me. This is
Right.
just something that happens.
Right.
And with help, I will be well, right? So
And you put a name to it too, right? Because you're like,
yeah,
am I going crazy? Like, what's wrong
right,
with me? Yeah.
right. Yeah, so that's why I share openly about my story and
Mhm.
encourage others to do the same. And
Mhm.
during this month, it is all about sharing stories. There's actually like a hashtag, we are 1 in 5,
Oh.
because 1 in 5 women will have a perinatal mental health disorder. So
Mm.
just it's that common, right?
Mm. Mhm.
So we encourage everyone to start talking about it more. But
Mhm.
so my experience actually wasn't even with my first, even though that was kind of traumatic because I had a COVID baby, but my postpartum experience with my second was the one that kind of launched me in deeper into this work, because as an OBGYN, I always took care of postpartum people. I actually really enjoyed my postpartum visits and always zoned in on that mental health screening,
Mhm.
because I felt like it was very obvious that these women were not getting the support that they needed. And
Mhm.
at the time where I worked, we had a pretty good support system for mental health. So it was very easy for me to plug them in. But I
Mhm.
recognized the importance of it to take the time to really dig in and evaluate. So it had
Mhm.
always been something that was particularly important. But,
Mhm.
you never really get it until it happens to you. And that was
Mm.
my situation, right?
Mm.
So at that time when I was pregnant with my second, I had
Mhm.
left my employed position. I was working for myself, doing
Mhm.
independent contracting as an OBGYN and also as an entrepreneur. So I had all of this time that was my own. So I
Mhm.
thought, okay, I'm working for myself. I
Mhm.
am a second time mom. I'm an OBGYN. I got this. Everything's going to be great. And
Right.
that was not the case. So I had her and very quickly started getting back into regular life.
Mm.
And I was still in a lot of pain
Mm.
physically, like
Mhm.
my tailbone, like I just had a lot of pain from the pregnancy left over and then from birth.
Mhm.
So I was very, very uncomfortable. And I just felt as the time went on that
Mhm.
even though the people around me really loved me, they
Mhm.
just didn't seem to get it. They did not seem to know or recognize what I was going through, and they were not
Mhm.
taking care of me the way that I felt like I should have been taken care of. So I
Mhm.
became very angry and very
Mm.
resentful,
Mm.
because, I was just like, but can't y'all see I'm struggling? Like, I'm in pain. I am
Mm.
anxious. I am angry. I need
Mm.
more help.
Mhm.
Why don't you see it?
Mhm.
But what I did not realize is that I was also acting like if everything was fine. I,
Oh.
recently, I went back into some emails from that time, and I was
Mhm.
sending emails like 2 weeks postpartum. I was at a in-person speaking event at 6 weeks postpartum.
Wow.
So I had all of these ideas, all of these expectations of myself
Mhm. Mhm.
that I was just acting on because I felt like, okay, I'm back. I have all this experience. I know what I'm doing,
Mhm.
but I was really struggling and
Mm.
not saying anything about it up until I kind of hit a wall. And
Mm.
I told my husband, I can't do this anymore. I need a break.
Mm.
I am going to take a trip to go to Mexico by myself. I'm just going to leave y'all here and you got it, right? Cool. And he was like,
Wow.
no, I don't got it. Yeah. Um, so he was not pleased. He was shocked and,
Mhm,
basically said, that's not happening. You're not going
mhm,
anywhere by yourself, especially not to
mhm,
Mexico. So he decided to come with me. My sister came from Trinidad to help with my children because my mom was here at the time. And
mhm.
they stayed with the kids and we went and basically kind of just reconnected. I got a break. I got a rest
Now
and
that's a
really,
village. That's
yeah,
amazing.
yeah,
Wow.
yeah. So,
Mhm,
and we could come back to that part, but
okay.
yes, I had lots of support in that respect, and
Mhm,
I had lots of support in my husband. So though it was a very rocky time,
mhm,
he understood the gravity of the situation
mhm,
that
mhm.
made me say that I'm just gonna go away for a little bit,
Yeah,
right?
yeah.
So him saying, let's go together, let's work this out. While we were
Mhm,
there, we did therapy, which did not work out. So he like printed out questions online that, therapy questions so that we could go back and forth. Like it
excellent.
was, yeah, it was what I needed to
Mm,
really take a step back and be like, what do I need in this time? And it is to
mhm,
take care of myself. It is
mhm,
to properly rest, properly recover,
mhm.
and heal mind and body because my
Yeah,
body was still not healed, right?
yeah,
I was
yeah.
still in a lot of pain at that point.
Mhm,
So I kind of just dropped off the face of the earth at that point. I was just doing my actual clinical work because I didn't have a choice. I had to do that. But
mhm,
everything else that I was doing just took a back seat. I got physical therapy, I got psychotherapy, and really just started to articulate what I needed in that time.
mhm.
So that it wasn't just me secretly being angry at everyone for not knowing what I needed,
Right.
and really just using my voice
Mhm,
and healing.
mhm,
So it was through that, as I started to come out of it, I said, I really want to help other moms avoid all of this, right? And
mm,
especially other physician moms who have that
mhm,
added layer of not only taking care of their families, but taking care of other lives as well.
mhm.
So it, you know, transitioned into me doing education focused on postpartum, and then webinars focused on postpartum, and then coaching focused on postpartum. And that's what my platform is all about right now. And through that healing journey, I discovered all of the information about perinatal mental health and an organization called Postpartum Support International that has a lot of free resources, which I really love.
Mhm.
And there's an additional certification that I am training for right now. I'm actually have to sit my exam just to, increase the level of care that I give to my patients because I know from the things that I have learned and the things that
Mhm.
I learned before, even after a decade of practicing, we are woefully unprepared to properly take
Mhm.
care of postpartum people in this season when it comes to mental health disorders.
Mhm.
So I
Mhm.
wanted to just do more in that area, particularly because of what I went through.
Yeah.
And now here I am.
Yeah. Wow, what a story. So
I
we
know
just on
it's a long one.
a number of things because I think a
Yeah.
lot of us as Black women um are task oriented, right? Like we got this. I got this. So I'm juggling 20 million things, but I got it. I got it. I got it. That
Yep.
sometimes people on the outside, it looks like we do got it all together. We're saying it, we're
Yeah.
doing it. And what do you think is a challenge for many of us to say, no, I don't have it. And
Right.
this is what I need. Because what you said was that you got angry and resentful. Like, why don't people see that I got this? Right.
Right.
What do you think is a barrier to many of us
Mhm.
saying, I don't have it or I don't have it all together and just saying, wait a minute, I need to pull back? What do you think some
Yeah.
of the barriers are with that?
There's so many. So within ourselves, there's one, right? Because you want to appear strong.
Mhm.
Sometimes you, in other areas of your life, you have to be strong. And,
Mhm.
recently there's been, pull away from that strong Black woman, whatever.
Mhm.
It can
Mhm.
be empowering, but it also can be like harmful, right?
Yeah,
That
absolutely.
embodying that. But
Mhm.
some people do have to be strong in their
Mhm.
lives as a
Mhm.
Black woman, as a woman in corporate, as a woman physician, or whatever else. So
Mhm.
if y- how you do one thing is how you do everything, right? So if you are in this professional job, if you are a physician in a predominantly white, predominantly male space,
Mhm.
and you have to be this way, it is very easy for it to then transition over into this part of your life when nobody actually talks about that part of it, right? When
Right.
you think about postpartum, everybody thinks about the baby and, oh, the
Mhm.
baby's cute, and, oh, it'll be great, and all of those things. So it's not something that you are preparing yourself for.
Mhm.
So for most of the time. So
Mhm.
if you are this way in your regular life for whatever reason, and you are just going to say, okay, well, I'm going to be the same,
Mhm.
but then the situation is different, right? Motherhood changes everything. It is the ultimate game changer. And it's not even just the baby, it's the
Mhm.
hormones, it's the fact that you actually physically have to heal. There's so
Mhm.
many different layers that
Mhm.
it can be a shock to the system
Yeah.
for a person who doesn't even know, and not even if it's just your first, right? I My experience was with my second. I've
That's
seen
interesting.
people have tough Yeah, I've had seen people have tough postpartum experiences with their third, fourth. It really
And I
doesn't
think that probably
matter.
throws them off. Like, wait a minute, I didn't experience this before. Why am I
Exactly.
experiencing it now?
Exactly. And there's so many reasons for that, even physically as well, right? Because you have something to compare it to, right?
Mm.
So in your mind, you're like, oh, well, this is going to be just like the last time, and I was
Mhm.
fine. And if it's
Mhm.
not, you're like, well, okay, well, what is wrong? Is something wrong with me? You are
Mm.
older. No matter how young you are when you started, I guarantee
Mhm.
you are older if you've had another baby, right? So your body is a little bit more tired. It's a little bit
Mhm.
more stressed, right? So it
Mhm.
is more on your body. So if you felt a certain way postpartum and now you feel a little bit worse, that in and of itself may make you feel depressed and not like yourself, right?
Right.
Not feeling at home in your body can be
Mm.
stressful and can be depressing,
Mhm.
So there's so many different layers to this, and
Mhm.
you know, being strong
Mhm.
can be important,
Yeah.
but being vulnerable, being open about your struggles
Mhm.
can be life-saving, right?
Yeah.
So, just really getting the word out as much as possible. I'll say it again and again. It is just important to have these conversations. So,
Yeah.
because somebody is going to remember this and be like,
Yeah.
okay, this is what they were talking about.
Yes, yes, yes. So how common is it to have these experiences, not for your first child, but for future pregnancy? How common is that? And what is the experience like, let's say with postpartum depression, if you
Mhm.
have other children and then you experience that? Like, what does that look like? Or what have you seen that looks like?
Yeah, it is more common than you think. And it's one of those things where, in terms of data, hard studies, this is not an area that is studied. When you think about how studies go, it's very male,
Mhm,
very, not caring about women in general.
mhm,
So
mhm,
to have hard data on that, it will be tough. But
mhm,
based on the stories of
mhm,
patients and clients, I know that
mhm,
that it is very common, and that
mhm,
you hit the nail on the head. The other children, that added
mhm,
layer of expectation, not only from your family, but
mhm,
on yourself as well, because there is that guilt. Like, I don't want my other children to
mhm,
feel like they've been left behind. I want to
mhm,
make sure that I spend time with them. And
mhm,
so you are now adding even more pressure on yourself, which is also what happened to me because
Mhm.
we brought my son out of school when my daughter was born because it
Hmm.
was flu season. We didn't want him bringing germs at home
Yeah.
with a newborn.
Yeah.
In hindsight, we probably should have just left him, but that just added it added an extra layer of stress because he was
Yeah.
like a toddler. It's not like he was an older child that could be entertained on his own.
Mhm. Mhm.
He didn't really understand what was going on. He loved his sister, but he is still wanted mommy
Yeah.
and you know,
Yeah.
yeah. So it definitely added two things. And even when we decided to send him back, then him being in and out with sickness,
Mhm.
having to shield, like I had to quarantine because we had COVID scares. Like there was so
Mhm.
many different layers with just logistics and
Mhm.
then adding everything else
Yeah.
with the pressure on yourself and different things like that. And
Mhm.
then if you don't have the support, like you mentioned, I had great support and I still
Yeah.
went through all of this. Now imagine if
Mhm.
you actually don't have any support, then
Wow.
what is the childcare situation, right?
Yeah.
When do you have
Yeah.
to go back to work? Like there are just so many layers to it,
Mhm.
and it's just like you wonder how more people aren't depressed, right? Because there's
Yeah.
just so many things that we have to deal with.
Exactly. And I'm curious because I talk so much about Black women in toxic jobs. For Black women who are dealing with issues of baby blues or postpartum depression, and they have to go back because their job is to only give them 6 weeks or whatever, and they end up going back into a toxic job, how might that impact them, in terms of
Yeah.
what they're already experiencing, and then they go back into a toxic work environment? How might that impact them
Yeah.
as well?
Yeah, that transition back to work is an area that I focus on. Unfortunately, many physician moms are in toxic job situations, and it is tough.
Did you say physician
It
moms? Did you?
physician moms.
Wow. So I want
Yeah,
to highlight what she just said.
yeah.
You just said most
Mhm.
physician moms are in toxic work environments.
Maybe not a
Wow.
lot. Yeah,
A lot. Okay.
a
And
lot.
that's
Mhm,
noteworthy. That's noteworthy. And this is May Mental Health Awareness Month as well. That's
mhm.
noteworthy because, again, helping healing profession,
Yeah,
psychologists, helping healing profession, but working in a toxic work environment. I just want to just uplift
yeah,
that. Okay, I'm sorry.
yeah. No, it's fine. Like it may be surprising, but there's a high rate of burnout, a
Sure.
high rate of physician suicide. Like
Mhm.
it's something that, unless you are in it, I don't think people would really know about. But
Yeah.
a lot of people are
Mhm.
in, corporate medicine. That's a whole other tangent that I could go off of as a work burnout survivor myself. But, it all that to say, it is really an important area for me as I return to work
Mhm.
because there's so many things to navigate
Mm.
besides it just being toxic. Like, what does that
Mhm.
toxicity look like? Is it
Mm.
that you don't get adequate breaks if you choose to pump at work? Or
Mm.
if they give you breaks, are they giving you a bathroom? Are you in a closet? Do you have a place to store your milk? Right?
Mm.
Like there's so many different things. If
Mhm.
you are you getting out on time to go and pick up
Mhm.
the baby? Are you
Mhm.
getting, the childcare? Like you have to get to relieve your childcare. Do
Mhm.
you make enough to afford the childcare? There are
Mm.
just so many additional layers when you have to talk about going back to work that
Mhm.
it really gets into that whole how do we treat postpartum people in general in this country
Yeah.
and what
Yeah.
kind of resources and support we give because it starts at the federal level, right? Because if at federally we don't have these protections, private
Mhm.
companies and things they aren't going to take it upon themselves to say,
Right.
oh well, let me just give you all this time. Some of them
Right.
do, but that in and of itself is a privilege, right? So
Mm.
there are definitely complexities there, and it will just exacerbate symptoms if you're already having
Wow.
them. And one
Yeah.
thing that we didn't talk about, because we're talking a lot about postpartum depression, but
Mhm.
something that may not be as obvious is that it's more than just postpartum depression. And especially the sneakier one, the one that can be easily missed, is postpartum anxiety, because
Mm,
it's easy to say, oh, well, it's just new mom jitters. She's just anxious because, it's the first time baby. Or she's, especially when you have professional working moms who
mm,
may already be type A. Oh, well, she's
mm,
just being her normal self, when it's
mhm,
really that she has postpartum anxiety, and that's why she can't sleep, because she's running through the to-do list. That's why she can't
mm,
sleep, because she's checking to make sure if the baby is breathing. Like,
mm,
there are all of these things that can be very, very easily missed in professional
mm,
working moms because of that high functioning type A type of personality. But then there are
mhm,
also postpartum OCD, there's postpartum psychosis. There are a lot of different things it could be. So the
mhm,
reason I like to talk about that is because, again, this idea you may have in your head of what postpartum depression looks like, and you may
mhm,
say, well, I don't think I'm depressed. I did this
mm,
thing, and I don't really think I feel depressed, but I don't
mhm,
feel right. I don't feel
mm,
like myself, right? So
mhm,
there's something wrong. Listen to your body. Listen to that voice inside of you saying something is not right, because it may actually be something else, and it's not
mm,
just something to brush off because it's
mm,
not depression like you think it is, right? So something
mm.
else that I wanted to bring up as well, that there are a
Appreciate you.
lot of different things.
Yeah, I don't think I've ever heard of postpartum anxiety and OCD. Now I
Mhm.
have heard of postpartum psychosis.
Yes.
So how would okay, are these conditions like reversible after a certain point,
Mhm.
like on their own, or is it more so because we talked about the onset with the
Yeah.
hormone drop and all that kind of stuff. Does it generally reverse on its own or what if people are
Yeah.
experiencing any of those symptoms?
Yeah, no, that's a great question. So thankfully, most of the time, it's gonna go away on its own. I just want to put an asterisk on that,
Okay.
because I don't want somebody to say, well, it's going to go away on its own. I'm just going to wait. So,
Mhm.
meaning you can get better with help, right?
Mm,
So, even if the help looks like therapy,
mhm.
group sessions, it doesn't necessarily mean medication. But
Mm,
if you just have a postpartum dot 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 anxiety, depression, and all that, it
mhm,
could just be due to your postpartum state. But one
mm,
thing that happens is that people with undiagnosed mental health disorders may first present in postpartum. So
mm,
if it comes up during your postpartum period and you already had it and it just was not diagnosed, not being treated, well, that
mhm,
that may not go away, but it's not
mm,
because it was, your postpartum state just carried on. It was because
mhm.
it just, manifested during this time.
Yeah.
Yeah. So one thing people are very worried about if they do need to start medication, say for depression, for postpartum depression, is that I don't want to be on medication forever. But it is
Mm,
one of those times where a lot of people are able to come off once they are out of the postpartum period, which,
mhm.
by the way, is 1 year after birth. I
Mm.
know a lot of people think about that 12-week mark, the fourth trimester, but postpartum
The
lasts for
year.
1 year. Mm-hmm.
That's good
Yeah.
to know too. So I just want to just reemphasize what you said. So it may, but you still need treatment. So don't think that
Yeah.
you're having these symptoms and like, oh, it's just going to go away. No, you still need treatment, but with treatment that it may kind of just
Mhm.
fade
Yeah.
out, right? But the
Yes.
other part too that I just thought of this question. So
Mhm.
what about people who already have some type of diagnosable mental health issue prior to
Mhm.
getting pregnant? Are they at
Yeah,
greater risk for these issues as well?
definitely. Yeah. And we, as usually, they will be under the care of a psychiatrist or psychologist
Mhm,
or both.
mhm,
And we know that pregnancy and postpartum can trigger relapses if your depression or whatever else is stable. If
mm,
you already have a bipolar disorder,
mhm,
that's the highest risk for postpartum psychosis is already having bipolar disorder. So these are
Wow.
things that we know, so
Mm,
that we can prepare for. The
mhm,
unfortunate things that happens is that there is a lack of education, not just with patients, right? Not just with the population, but in the
mhm,
medical field as well, because people
mm,
are scared of pregnant women in general, right? So as
mm,
soon as you find out somebody is pregnant, oh, I don't know what to do. Let me take you off all your medications because we don't want to hurt the baby. It's
mm,
usually all about the baby. And don't get me
mm.
wrong, I love babies. I have two of my own
Yeah.
that I love.
Mhm,
However, I love moms more. And
mhm,
nothing irritates me more than people just stopping medications, saying you
mm,
can't have treatments, you can't do testing just because you're pregnant without
mm.
doing anything to figure out if that's actually true, right?
Uh,
So the majority of medications that a reproductive age woman is going to be on for a psych diagnosis are going to
mhm,
be okay to continue.
hmm,
There are ones that have higher risks, and that's why you need to be under the care of a physician who's going to know that. But
mhm,
the bigger risk to the baby is an
mhm,
untreated mental health disorder. So, yes,
mm,
medications may not be studied, they may have risks to the baby, heart,
mhm,
whatever, but the even bigger risk is
mm.
that chronic stress of an
Yeah.
untreated mental health disorder. So, if you're already on treatment and you find out you're pregnant, that's when you call your doctor right away to find out
Mm.
what to do, because a lot of patients just stop everything because they want to protect their baby. You know,
Right.
the instinct is I don't want to do anything to harm my baby, so let me just
Right.
pop these injections. But a lot of
Yeah.
times you stay on it once you've had a conversation with your doctor who is aware of the actual risks and can
Mhm,
counsel you, and then you make a decision together, right? And at the end of
mhm,
the day, you are in charge. So if you still want to stop, that's great, but at least
mhm,
you have all the information and know, what you're getting yourself into. And then because of that relationship, you can say, if as things go on, I don't feel well, my depression, my anxiety, or whatever is out of control, I'm already
mm.
plugged in with my doctor, and I can talk about restarting meds. I can talk about switching to something that may be safer. Like, there are a
Mhm.
lot of things that we can do besides just saying, just stop all of it.
Yeah, yeah. I appreciate what you said, that we have to be mindful that the chronic stress, untreated, can be more harmful to the baby for the
Yep.
mother, right? It could be more harmful to the baby than the medication issue. So having
Yep.
that conversation is so important. So for Black women watching this now who may be
Mhm.
pregnant, and or those who we have loved ones who might be pregnant,
Mhm.
how can there be a way to identify the differences between postpartum depression and postpartum psychosis?
So postpartum psychosis it's an emergency. And when I talk about the distinguishing factors, I just want to let people know this is not for you to diagnose people. That's a lot of pressure, right,
Mhm,
on family members to be like, oh, well, I missed it, right?
mhm,
So really just knowing the person who is pregnant and looking out for changes, and then
mhm,
encouraging them and supporting them to get help and get evaluated, right?
mhm,
So
mhm.
just being in tune to the fact that these things can happen, but I never want people to have this pressure, like, okay, let me make sure I'm observing and checklists and all of that, because it's a lot.
Right,
It's a
right.
lot of pressure. But postpartum psychosis is a very scary thing, right? When you hear about it, most people have heard about it like you, because it
Mhm,
is so significant, because
mhm,
the rate of death by suicide for mom and infanticide, meaning mom hurt the baby, is
mhm,
so high when you have postpartum psychosis. So when you hear of stories where the mom was hearing voices, right? Somebody
mhm,
was telling her to hurt the baby, or she
mhm,
was saying, the baby hates me, the baby is possessed, or
mhm,
it's a very stark difference to the person's usual personality, and it's usually like a third party thing, like somebody told me, or the baby is doing this. You know,
Mhm.
I'm not a good mom, so the baby doesn't like me, so I'm just going to go away and, you know,
Mm.
take my life or something like that.
Mhm.
And that, if left untreated, can lead to, death by suicide. So
Wow.
if there any signs of anything like that, that's like a 911 kind of emergency. It's not
Yeah.
just, well, see if we get evaluated. That's something that people usually have to be in the hospital for, and
Mhm.
again, can be treated, right? So you can be treated and it can be well. So
Mhm.
having the intrusive thoughts, like the thoughts of, the voices and all of those things,
Mhm.
it can seem to the person like, yeah, that this seems reasonable. Whereas
Mhm.
somebody with intrusive thoughts, where maybe like OCD or something like that, the
Mhm.
thoughts are scary to them. They seem completely out of alignment with who they are as a person.
Mhm.
And
Mhm.
then that's when it triggers the compulsions to get rid of those intrusive thoughts, right? So the
Mhm.
the difference and why it becomes psychosis is because the person is like, yeah, this seems reasonable. They
Yeah.
may be scared by it, but it's like, yeah, I'm gonna listen to whatever this is.
Yeah, it's a total break of reality, right?
Mhm.
So,
Yeah.
and I know we talked about this previously. I just want to remind people of this again, okay? So you talked about baby blues and postpartum depression, how it's different, right? Can you talk a little bit more or restate the
Mhm.
treatment recommendations for baby blues compared to postpartum depression? Because we said with postpartum psychosis, that's 911. That's like an
Yeah.
immediate intervention,
Yeah.
right?
Mhm.
For baby blues and postpartum depression, and I know baby blues is not a diagnosis, but still,
Yeah.
what are some things that need to happen if
Yeah.
there's either this or that?
Yeah. So baby blues is just time. Like I said, the 2 weeks, it will resolve on its own, having loving support, having all of the help in the world, useful help, not just warm bodies in your house
Good
to
point.
annoy you. Yes. Actual
Good point.
useful help.
Yes, like
But
you can
that
add more baby. Like I'm trying to take
exactly.
care of baby, I can take care of you too. Yes.
Exactly. So that
Uh-huh.
will get better on its own. For the depression, and it's not to say that depression cannot happen within the 2 weeks. It's the
Mhm.
difference is that baby blues will only last for up to 2 weeks, right? So you can start having depression symptoms much earlier. The
Mhm.
first line therapy for depression in and out of postpartum is therapy. It is psychotherapy, and that's what we recommend for most people. I think support groups are really, really helpful, especially for this postpartum time. It's
Mhm.
just good to be in community with other mothers like we were meant to be.
Mhm.
Every single African friend I have, there's a tradition of, surrounding the mother and the community and things after birth. We have gotten away from that because of racism, as
Yes.
with everything else, right?
Yes.
But being in that community of support of people who have gone through what you are going through, who are currently going through it, can be
Mhm.
very, very helpful. You can
Mhm.
see the light at the end of the tunnel for people who have gotten further through with their treatment.
Mhm.
You can even see people who are doing worse than you. You can help them. You can,
Mhm.
it can give you, people like being helpful, right? So
Yeah.
if you can share how you got through something with somebody else who is struggling more, it can make
Mhm.
you feel good about yourself. It can make you feel like, oh wow, look at how far I've come. So
Mhm.
being in groups is very, very helpful.
Feeling
And
a
the
community.
organize yes, exactly.
Mhm.
And the
Mhm.
organization I mentioned before, Postpartum Support International, they have several online groups that are free, and they have it broken down by groups. So there's one for Black women, there's one for Latinx
Mm.
women. There,
Ooh.
people who've had survivors of postpartum psychosis, infertility, like all different resources on there. So that's why I really like them. I don't work for them. I don't get paid by them. Just
I'm gonna
put that out
I'm
there.
put them straight. So postpartum Postpartum International, right?
Yes, yes. Uh,
Awesome. Okay.
yeah. So, and if you're doing those things, or even if even in conjunction, there's
Mhm,
always medication. And I always mention it last because people don't like to hear, medication for postpartum
mhm,
depression for a lot of different reasons.
mhm.
But as we mentioned before, it may be that you need it, but it may not be forever, right?
Right,
So
right.
it's not something that we have to fear. There are lots of safe ones if you choose to breastfeed, and
Mhm,
it can possibly accelerate you getting better, right?
mhm,
So it's just one tool that we have to
mhm,
help you be well, right? And I
mhm,
recently watched a documentary during Black Maternal Health Week that
mhm,
she made the film when she was in medical school. She's now an ER physician in training, and it's called Through the Lens. It was following three Black moms through their different journeys. One of them had postpartum depression and anxiety. And she talked about
mhm,
how she hid her medications even from her mother and her husband because she was so
mhm.
ashamed that she had to be on medication. Right. So this is
Oh,
a real thing. This is a real aversion to getting help. And at least
mhm.
she took the medication but hid it.
Right,
But there are some
right.
people who don't even want to go and get it. Right. So there are options, and the message that I want to drive home is that with help, it could be therapy, it could be groups, it could be medication, but with help you will be well, right?
Yeah,
So yeah.
that's great. That's great. Now, are there any treatment barriers? So you talked about therapy a lot. So what might be some of the barriers to Black women accessing therapy for postpartum depression?
Yeah. So there are many, um from all different angles, right? So is your insurance going to cover it? So if you say yes, I want therapy, is it
Mhm,
available through your
mhm,
insurance? If they
mhm,
cover it, do they have openings? Right?
mm.
When I was postpartum and I was looking for a therapist, even with my nepotism as a physician, I was told it would be several weeks. And in this time, if you are brave enough
Several
to
weeks.
say, exactly,
Ooh,
if you're brave enough to say, I need help, and you're ready for the help now, w- several weeks,
right.
so
Gosh.
it de it depends, and then, yes, you can pay to see somebody, but can you afford it, right?
Mm, mm,
Because you can be seen right away if you want to,
mhm,
but if you're trying to go through your insurance, then that's where the barrier comes from. And
mm,
then there's the societal barrier as well. Are you ashamed because you have to go to
mm,
therapy?
mhm, the
Do
stigma.
you have a negative connotation in your family or whatever before the medical field? Lots of Black people don't trust doctors for very good
Mhm,
reasons, right?
mhm,
So, and especially psychiatrists
mhm,
and psychologists, we pray it away, right? You don't
mm.
need medication. That's the white man's
Right.
what, we can go on and on, right?
Right.
So, there are lots of different barriers, and it's a work in progress, right? The more conversations, the more it's normalized, and then we can just really overcome those things and
Mhm,
just make it more accessible to everyone. um and that's where some of the advocacy works comes in as well, so that
mhm,
there's more coverage, there's more insurance coverage, more
mhm,
accessibility for
mhm.
everyone.
Yeah. Okay. Okay. That's really good. So, as we're winding down, can you talk a little bit about all the services that you offer, how people can get in contact with you, and then I'll read the community chat.
Yeah, so I just want to thank you so much for this conversation. I love
Yes.
talking about all of these things. Yeah. So I am a coach for physician moms, as I mentioned. I also coach professional moms as well, but I have a special place in my heart for my fellow physician moms.
Yeah.
Um, and I do individual coaching just to help navigate this very special but very challenging time in our lives. And so
Mhm,
those early years of motherhood. And I also offer online, like digital courses, and I do all of everything that I talk about right now, spread the message widely on my social media platforms and my podcast that will be dropping next week.
Oh, tell me
So
your
yeah,
podcast.
Stethoscopes and Strollers is the name. And, it's just a part of spreading this message, right? Like I said, we need to talk about it more and more to normalize all of these things. And I know I cannot personally work with everyone. So
Mhm.
this is my way of reaching everyone, right? So
Ah,
yeah, so you can find all of those things on my website at
yes.
drtoyacoaching.com. So that's DRTOYA coaching.com. And all of my services, all of my content, and the postpartum mental health resource list that I have is also there on the top as a banner and also in my resource page. And this is all free information that's online that I just put together for easy access for pregnant people and their families, right? All of those things are available so that we can take care of our women who are bringing forth the most important people, the children.
Exactly, exactly.
Yeah.
And what I appreciate you talking about is that we can't forget the mothers, right? We love the
Mhm.
babies,
Yes.
but you can't forget the mama too.
Right.
So how do you
Right.
support Black mothers as well? So I'm
Yeah.
going, and I just put your information on the
Mhm.
screen, and I will also include all the information description section. So I also want to speak to or talk to our community. So
Yes.
thank you, community, for being here today. Good evening, friends. Time to learn and grow together in our weekly session. Yes, indeed, indeed. Hello to say hello. Are they beginning to? This is a question to you. Are they beginning to train student physicians differently in medical schools to address our needs?
Yes. So the change is happening, but change comes slowly. And,
Mm,
these people are in medical school for 4 years and then they have to come out and be trained in residency. And one thing with the way medical training is, we're trained by the people who come ahead of us, right? We
mhm,
still have a group of physicians that are old school. They haven't all
mhm,
retired yet. So
mm,
sometimes it feels like we're fighting an uphill battle trying
mm,
to, undo some of the more harmful ideas and teachings that are out there. But there
mhm.
is hope. The new generation, and I feel so old because I'm 10 years out. Uh, but yes, the new generation, they're, being trained differently, even than I was. Like 10 years was a long time ago in terms of medical training. So the training it looks a lot different,
Mhm.
very patient-centered. Um, and yeah, things are looking up.
Yeah. So there's still a long way to go, but there's
Yeah.
been some progress. Okay, that's good to know. Stress can be related to not having a supportive partner or not having a partner at all, right?
Yeah.
So the importance of still trying to find community, even if the partner's not involved, but the
Yeah.
stress involved with that when your partner's not involved. Can you speak a little bit about that?
Yeah, so curating your community is one of the most important things, right?
Mhm,
So not having the partner involved, that could be a different level. So the
mhm,
partnership could have broken up during the pregnancy, before the
mhm,
pregnancy, because of the
mhm,
pregnancy.
mhm,
So really, it's difficult to say, don't worry about that, focus on yourself. But that's what it comes down to in this time, even if you have a partner. Is
mhm,
and it's like my central message to all moms, you have to
mhm.
focus on yourself,
Yeah.
even before the baby, even before
Mhm,
your partner,
mhm.
because without you, the baby will not be okay. Your family will
True.
not be okay, right?
Mhm,
So, doing whatever you need to do to take care of yourself and decrease that level of stress. And if that the focus is within, everything else will fall into place. And part of that caring for yourself is having people around you, which may not be blood, it may not be
mhm,
your partner, but
mhm,
people that are there to support you and understand what you're going through, that will not
mhm,
judge you, and that
mhm.
will really just be there to love you is really, really important and really the focus if, the partnership is not what it should be.
Yeah. And also, like you said before, like sometimes it may not be blood family, but it's
Yeah.
other community of support, just like the group you talked about before, which I'll have a
Yeah.
description section. That might be a resource as well. I'm
Yeah.
so sorry that you had this experience, Dr. Toya. Thank you for
Mhm.
sharing your experience. Hellos. Let's see. I was diagnosed with severe postpartum depression with my first
Mhm.
child. They think it may have been triggered by me having to abruptly stop breastfeeding due to the
Mm.
C-section infection. When I initially called my HMO's mental health department for help, they said that it would take several weeks for an appointment. Oh my gosh.
Mm.
Then they heard my baby cry and I got in right away. Wow.
Yeah.
That is, mm, thank God your baby cried, right? But that just speaks
Right.
to systemic issues
Yes.
that it takes that long to get support. And these are
Yeah.
mothers, trying
Yeah.
to take care of their children, but they're struggling and trying to ask for help. Wow.
Yeah.
That's amazing. Yeah. Um, and that was my friend Colette Elizabeth. I'm glad you were able to receive help. Hope you and your baby
Mhm.
are doing better. Oh, yes, they're doing very well. They're
Yeah.
adults. Yes, another informative session. Thank you all. With my second child, it was extremely high risk pregnancy and was
Mhm.
placed on bed rest for almost 5 months. Wow. I
Mm.
asked to have medical ready for me just in case I needed it, which I did. Wow, that's amazing. Yeah, I didn't know that, Colette. So I think a lot of us have had some type of medical trauma in
Mhm.
the past, but I think what's important for us to look at is the medical trauma and the mental health part, right?
Yes.
So, sometimes you think, oh, well, I got to focus on the physical. We're saying you got to focus on the physical and the mental health part,
Yeah.
and when to be aware that there's some signs that maybe we might need some additional support. And what
Yeah.
I really appreciate you talked about too was sometimes you're going to need to advocate for that support, right? Now,
Mhm.
if there are family or friends or whatever around the pregnant mom, this information is also valuable to them because
Yes.
the mom may not recognize she's different, but they
Yep.
do, right? So they see a change in her baseline behavior. So all of this information is very helpful for any of us who know a
Mhm.
mom who is pregnant, right? Or just
Yeah.
had a baby, and ways that we can best support her. So, as we're winding down, any last words you want to share with the audience today?
Yes, just to piggyback off of what you said for the family, all of those
Mhm,
resources that are on my resource list that are out there are for family as well. So the suicide hotline, that's the
mhm,
federal program, is for
mhm.
family. Postpartum Support International has a warm line, so it's not like an emergency line. It's also for family because, like you mentioned, they may not be able to see it, but you
Mhm.
may know that something is wrong. And
Yeah.
it can feel so helpless to
Mhm,
see the person you love suffering and not know
mhm.
what to do. But there are
Right.
resources for you as well so that you can help and get her the support that she needs.
Mhm. Can you further describe just a little bit the warm line? Because I think some people may not
Mhm.
understand what that is.
Yeah, so if you think about like a hotline, like, many songs, I won't sing any, but like a hotline is like like an emergency line. So like the
Yeah.
suicide hotline is 988, right? So that's for emergencies, want to end my life, I'm having suicidal thoughts, that's a
Mhm,
hotline. A
mhm,
warm line is for a non-emergent thing. I just don't feel like myself. I think I need some help. My daughter doesn't seem like herself. She's crying all the time, whatever it is. So
mhm,
it's not for an emergency. So those, it may not be staffed by medical professionals. They may not have the immediate resources or the adequate training to deal with a true emergency. So that's why they
mhm,
say it's a warm line as opposed to the
mhm.
hotline.
Very helpful.
Yeah.
So it's for not only those for mothers, but also family members in terms of
Yes.
support. So again, I'll
Yeah.
put all the information description
Mhm.
section as well. So everybody has that. So as we're
Yeah.
winding down, everybody, please give this video a thumbs up.
Mhm.
Also, share this video with other mothers, right? Black
Mhm.
mothers, and or those who have a Black mother around them, right? Because the Black
Yes.
mother may not be so busy like trying to take care of the kids, but her mother, her cousin, her aunt,
Mhm.
so that we can all support the mother, right, and getting the resources that she might need. And again, if you haven't already registered for the Job Liberation Virtual Summit for Black women that Marissa Price and I are co-hosting May 18th and 19th, register. The information is right there on the screen and also in the description section. And if you want to sponsor a Black woman to come, then you can also do that by going to the description section and emailing me, and we can make it happen. If you want to come to the summit, you don't want people to know you're there. Nobody will know. Your name won't be listed. Your face won't be on camera, only the summit speakers, okay? If you have something you want to say or a question, you can change your name on the platform, and you're going to be learning from other Black women who've left toxic jobs and are doing well, and teaching you how to replace your income, what to do about your health insurance, your life insurance, your retirement, okay? So again, share this video with at least 2 other Black women. If you haven't already subscribed to my channel, please do so, and turn the notification bell. I always forget to say that. And give this video a thumbs up, okay? So everyone, have a good night, and I'll see you later. Can you just stay on for one moment, okay? Okay,
Yes.
bye, everybody. Take care.
Thank you.